Hello, today is Thursday, March 11th, and we all know that tomorrow, March 12th, marks a day that I think will remain in our memories for a very long time. It was the day the first patient diagnosed with COVID-19 arrived at Silver Cross Hospital. We had seen pictures from hospitals in New York, and of course, we were worried and confused. A year ago, we didn't know if we should wear masks or not. We didn't know about medications for COVID. We didn't know what was needed to keep everyone safe. But we learned quickly and made modifications as information became available. Our medical staff pitched in, notably the critical care and infectious disease physicians and mid-levels, who worked tirelessly with our care team to save patients' lives. A special thank you to Dr. Atul Gupta, the medical director of infection prevention, and his colleagues who guided our decision-making. We had no idea how many more patients would be coming. And of course, there were more patients, a lot more patients. Silver Cross Hospital became a hotspot. We scrambled for vents and for personal protective equipment. Recommendations changed, sometimes on a daily basis, and yet we continued to adapt. I remember talking with Josie, an ICU nurse who cared for one of our first COVID patients, as she explained the benefits of a rotating bed. Our attention focused on getting test kits, and we were anxious over how long it took to get results. Our emergency department and all our patient floors were bursting. And yet, we took the time to celebrate when Helena Zabinski went home healthy after 5 weeks in our hospital. Summer did bring us a little relief, but unfortunately, as Dr. Fauci had predicted, the fall did bring a new surge, and we responded, but the exhaustion was clearly apparent. Yet you pushed on and put patients first. We all know someone that has had COVID-19 and suffered, and fortunately most survived, but some did not. And those that left us were not just a number, they had a name and loved ones. COVID is not over, but we have shifted our attention to vaccines and have become the largest vaccine site in Will County. First healthcare workers, then teachers, now people over age 65. We've developed partnerships with the National Hookup of Black Women and the Spanish Community Center to be sure we are providing vaccine access for Black and Brown communities. We are living our mission of advancing health, and it is wonderful to see the hope and the joy the vaccine clinics bring. Tomorrow is not a celebration, but it is a day of recognition and appreciation for all of you. To date, we performed 51,200 COVID tests and served 2,256 inpatients. Your efforts are exemplary, and your compassion and empathy for what families have experienced was and remains unrivaled, perfectly in line with our vision. Our organization is stronger, and my heart overflows with gratitude to each and every one of you. Thank you for battling COVID-19 this past year.